I treat a lot of people in a lot of different pains, and the people that come to see me that are the most happy are the ones that I replace their joints. People that have really bad hips or really bad knees that are having a hard time walking. It's a life changer. I can't tell you how many times per day some people come in after this and give me a hug, and so that's probably the most rewarding thing, is that when you change someone's life, someone that's in a wheelchair or really can't walk, that's probably the most rewarding thing that I do. I like to use my hands. I like to fix things. I was always into my hands, and I like to help people. And so again, orthopedics seems to combine the best way for me to use my hands and do things that are creative and figure things out, and also help people as well. I'm very into communication with the patients. I want them to understand what we're doing. I'm very into being an honest and open relationship with the patients as well, trying to tell them exactly what's going on, and spend a lot of time really explaining their problem to them, and why we're going to do what we're going to do. And they also have a fair amount of choice too. There's not one set way to do things in orthopedics. My most rewarding day has to do with treating a patient that came in to see me for a knee problem, and when I examined her, she had some weird reflexes, and it turns out that after a couple of tests, it led me to get an MRI of her brain, and she ended up having a brain tumor that nobody had diagnosed, and we ended up sending her. She got it taken out, and she's still alive, 5 years later.